There are almost 11 to 21 million cases of typhoid and paratyphoid throughout the world. Paratyphoid is almost 1/5 of the total burden of the disease. Almost 130 to 160,000 deaths occur annually globally. I'm Farah Kamal. I'm a professor of pediatric infectious disease at the Ahan University and also a visiting professor at the Oxford University. I've been working in typhoid research for more than a decade now. Typhoid and paratyphoid both are enteric infections acquired by swallowing the bacteria which is acquired by fecal-oral route and reaches the gut and then spreads into the bloodstream to cause infection. Almost all cases present with fever. There is abdominal pain, either constipation or diarrhea, and in some cases there may be a rash. Some cases may present with complications like jaundice, meningitis, and the worst of all being intestinal perforation. Water and sanitation is the key. We need clean water, we need hand washing, and together these two can prevent and decrease the burden of the disease globally. But where this is not possible in low-middle income countries, vaccines can do the job. We have a very good and effective vaccine against typhoid, which is the typhoid conjugate vaccine, and it has been implemented in many endemic countries throughout the world. But the paratyphoid vaccine is not yet available for public use. There is some research work going on the development of this vaccine, and soon in the coming years we may have a combined vaccines against typhi and paratyphi.
I'm Meg Vicentine, and I'm one of the doctors working at the Oxford Vaccine Group, and I'm currently studying a vaccine against paratyphoid fever. A few vaccines have already been developed against paratyphoid fever. So, for example, there is an oral vaccine that is made from live but weakened bacteria that could cause paratyphoid, and there are inactivated injectable vaccines made from bits of the paratyphoid bacteria. And they have been tested in human volunteers, and we know that they are safe. But to progress to studies to investigate if they can protect people against the disease, that would require for people, volunteers that are taking the vaccine, to get infected with paratyphoid. And this could take tens, if not hundreds of thousands of people to be vaccinated to investigate if this vaccine works. That's when challenge studies are going to be helpful for the development and the research of vaccine against paratyphoid fever. So what are challenge studies? So they are studies that are going to be giving the infection to people that did receive the vaccine and people that did not receive the vaccine. Obviously, this is done under very controlled circumstances so that we can just treat as early as possible in the course of the illness, and the people would not get too sick. When exposed to the bacteria that caused the infection, then we could test and see if they actually are protected because of the vaccination. So this is not a novelty. So challenge studies have been used in the past, for example, with the typhoid vaccine itself. We have recently completed a trial that was testing a new vaccine, this oral vaccine, and it seems to work quite well to protect against paratyphoid. And now the next steps are going to be to investigate vaccines that could protect against paratyphoid fever that would be injectable. Then they could protect against both typhoid and paratyphoid fever at the same time. And the idea is to test these vaccines using the challenge model again. We at the Oxford Vaccine Group are now working with many partners across the globe to test this new vaccine. We hope to have some results of this trial that is going to be called BiVISTA within the next year.